Okay, here's next domain 2, multi-sector collaborations to build health partnerships. I would like to highlight Thai Health. Maybe Barry is going to talk about this too. Thai Health Promotion Foundation, independent public agency. Main mission is to support health promotion in Thailand, provide catalytic funding for projects to change public values, lifestyles, and social environment. Seems like culture of health to me. Pursues a social cultural, not a biomedical model. Social determinants of health. Okay, here's the key thing. This effort is funded. How is it funded? There's the 2% tax on alcohol and tobacco that goes to Thai Health. That's their funding. There's also an excise tax to discourage people from using it. This 2% funding is providing $150 million a year for health promotion in Thailand. All right, so that's fantastic. A model we would love to have here. I would love to have it. So what are they doing for physical activity? They have a physical activity and sports media campaign. They're developing and disseminating evidence-based strategies. They're encouraging all levels of government to create safe environments for activity. They're developing a policy and environment change strategy and creating a physical activity research center. So they're really early in their physical activity work. They've been working on other things, but they're certainly going in the right direction, multiple partners. So about collaboration, I want to just give you a little sense of our work in IPEN, which is the International Physical Activity and Environment Study. And here's the website here. This is something we've been developing for 10 years, international network of researchers, and we're just publishing our first results now because these things don't happen immediately. And we have some IPEN experts in the room, Deborah Salvo, who led the study in Mexico, and Mike Pratt, who's been a partner with us since the beginning. So what does IPEN do? We encourage environment and policy research on physical activity worldwide. We develop and encourage use of common measures. We're continuing to do this. We support investigators to obtain internal funding, and we're coordinating 2 international studies. One on adults, funded by NCI, that I'm going to show you just a couple of results. One on adolescents, funded by NHLBI, that is ongoing. And then we want to use the research and communicate it to decision makers. So here are the 12 countries that are in the IPEN adult study. You see they're scattered all over. I'm pleased to say that in the adolescent study, we've added Nigeria. So we have some representation in Africa now. So do environments vary across the world? Yes, they do. This is GIS-based walkability index, and you can see just a huge variation. If you just look at the medians, there is a 9 standard deviation difference in walkability, going from the low of New Zealand up to kind of Hong Kong is on its own planet in terms of walkability. And so just a couple of findings. This is neighborhood environment and walking for recreation. So we see aesthetics are very important for recreational activity. And people, if they live in a neighborhood with better aesthetics, there's a 26% increase in their odds of walking for recreation. We also see safety from crime having an apparent effect, and few cul-de-sacs, so street connectivity is not so important, but also proximity to parks being important. So we're seeing these things around the world. Here's just a sample of relation of one environmental factor, local destinations being proximal or mixed land use. And you can see across all the cities in the study, most of them are positive. Only interesting, Bogota is a little different, but virtually all of them are either a weak effect or a strong positive effect. All right, so you see some variation, but overall, international evidence that built environment matters for walking for transportation. And here's one on BMI. And what we found was the multi-item walkability index had the strongest relation to BMI and weight status. So this is putting multiple variables together. How you design an environment seems to be related to risk for obesity. Safety from traffic was also related to BMI and weight status, pointing at the transportation sector. Land use mix diversity, pointing to the planning sector. Safety from crime, pointing to the criminal justice sector. And these relationships were statistically consistent across all these countries. All right, so they really generalized. Okay, so here's an example, I think a dramatic piece of data I want to credit John Pucher with, of showing the relation internationally between active transportation, that's the green line, which is lowest in the US, highest in these European countries, and obesity rates, which are highest in the US and lowest in the countries with the most active transportation. And yes, it's correlational, but wow, does it look dramatic. These countries have been working hard, changing policies, investing in active transportation. And they're certainly getting more active transportation and maybe just coincidentally, lower obesity. Okay, let's go back to South Africa. Passport to Health. This is a school-based intervention targeting the school environment. And so what are they doing? Simple, cheap things. Painting game markings on playgrounds. Putting in playground stations. Some of them, just putting in tires so that kids can run through them. Small equipment, ropes, frisbees. Okay? Cheap, simple. And the evaluation with accelerometers showed higher physical activity after the program than before, for boys and girls. All right? Low cost. They're doing it in South Africa. It's evidence-based. Why aren't we doing it?